A single yoga pose each day may improve spine curvature for scoliosis patients. A new study claims performing a single yoga pose for 90 seconds for at least 3 days a week could reduce spine curvature in patients with scoliosis in as little as 3 months. The researchers, including Dr. Lauren Fishman of the Columbia University College of Physicians and Surgeons in New York, published their findings in the journal Global Advances in Health and Medicine regarding the benefits of yoga for scoliosis. Friends, in this video, we will cover the topics such as what is scoliosis, types of curves, what are the cause and symptoms of scoliosis, various treatments and how can yoga help in scoliosis, and the do and don'ts while sequencing the yogic asanas. Namaste, friends. So friends, first and foremost, it's important to understand what is scoliosis. So scoliosis is a condition in which the spine curves to the sides. Although scoliosis can affect all age group, but it's mostly common between the age of 10 to 15. Severe scoliosis, defined as a spine curvature of more than 45 degrees, is usually treated with surgery. There are non-surgery techniques available for patients with spine curvature less than 45 degrees. One of the most common being bracing. Unlike kyphosis and lordosis, this is the outward and inward curvature of the spine respectively. Scoliosis refers to the sideways or lateral curvature of the spine, while a healthy spine will have some degree of kyphosis and lordosis. Ideally, there is no lateral curvature at all. Viewed from behind, the spine should appear relatively straight from the neck to tailbone. Scoliosis has been observed in 10.7% of women and 5.6% of men between the ages of 25 and 74. In an older population, scoliosis may occur in up to 68% of individuals due to osteoporosis, loss of bone density, which has been observed in many older people with scoliosis. Let us talk about the causes of scoliosis. In around 8 in every 10 cases, the cause of scoliosis is unknown. This is called idiopathic scoliosis. Idiopathic scoliosis cannot be prevented and is not because of bad posture, exercise, or diet. Your genes might be one of the reasons, as it sometimes runs into families. Now, let us talk about the types of scoliosis. Now, the first one we have is congenital scoliosis. Congenital scoliosis is rare and affects only 1 of 10,000 newborns. This comes from spinal abnormalities that grow in the womb. When the fetus develops, the malformed vertebrae is one of the major regions for congenital scoliosis. It can also come from incomplete or partial bone formation or missing bones. Early onset scoliosis. The most common age range for the scoliosis diagnosis is in adolescence. That is why it is known as adolescent scoliosis. When it happens before the age of 10, this is mentioned as early onset scoliosis. Adolescence idiopathic scoliosis. Adolescent idiopathic scoliosis is one of the most common forms of this disease. One out of 4 children is affected by this disease, aged between 10 to 18. As the name suggests, This disease occurs at adolescence stage, but no cause still has been identified. Degenerative scoliosis. Adult onset scoliosis or degenerative scoliosis is recognized by the side curves of the spine that grows with time. Spine degeneration and disc problems are common symptoms of aging. When the disc and joints start degenerating and degrading, it causes spinal curvature on one side. This is the most prominent sign of scoliosis. It commonly grows in lumbar spine and in the lower back and takes the C shape. Neuromuscular scoliosis. Neuromuscular scoliosis develops due to several reasons that cause spinal disorders along with the problems in the brain and muscles. When the nerves and muscle cannot maintain the right alignment, it leads to a curved spine. This curvature grows in adulthood and becomes in the patients and they become unable to walk. Now let's talk about the types of curves in scoliosis. The most common curvature pattern in scoliosis is a spinal curve to the right that is known as dextroscoliosis. Usually this occurs in the thoracic spine, with the midspine curving to the right as if to avoid the heart. On the other hand, a leftward curve known as levoscoliosis most often occurs in the lumbar spine. On the other hand, a leftward curve that is known as levoscoliosis most often occurs in the lumbar spine. Both of these spinal curves are examples of a singular C curve, one concave side, which curves inward and is shortened, and one convex side which is lengthened and rounded laterally. But in some cases of scoliosis, there are S curves. For example, the right thoracic curve may be accompanied by a left lumbar curve, making an S shape with two concave sides and two convex sides. Some, but not all, S curves may start as C curve. Reif says compensation over time may cause an S as the body attempts to level itself. But one curve is generally larger, a major curve, and accompanied by more restrictions. That's the one you want to focus on in your yoga practice. You will feel the greatest effect of stretching and strengthening there. Now, let us try to understand the symptoms of scoliosis. Symptoms. Scoliosis symptoms in kids. Let's talk about that first. Every child with scoliosis is different. Some don't have any symptoms. Others have very obvious ones, like their shoulders are two different heights. Their head doesn't look centered with the rest of the body. One hip is higher than the other or sticks out. Their ribs are pushed out. When the child stands straight, their arms don't hang down straight next to the body. When they bend forward, the two sides of their back are different heights. These changes to your child's body can affect their self-esteem. Now, let's talk about the scoliosis symptoms in adults. Some adults who have this condition have had it since they were teenagers. Over time, the curve can grow. Often, back pain is the first sign of scoliosis in adults. The pain may be from bone damage in the back, not the scoliosis itself. As the spine curves, it can put pressure on nearby nerves and cause symptoms like weakness and numbness. In adults, scoliosis causes symptoms like these: uneven shoulders and or hips, bump in the lower back, numbness, weakness or pain in the legs, trouble walking, trouble standing up straight, tired feeling, shortness of breath, loss of height, bone spurs, bony bumps in the joints of the spine from bone and joint damage, feeling full quickly when you eat. This is because your spine is putting pressure on your belly. Now let us talk about the treatment of scoliosis. Now, scoliosis treatments vary depending on the severity of the curve. Children who have very mild curves usually don't need any treatment at all, although they may need regular checkups to see if the curve is not worsening as they grow. Bracing or surgery may be needed if the spinal curve is moderate or severe. Factors to be considered includes: many people will not need any treatment and only a small number will need to have surgery on their spine. Scoliosis brace. If your child's bones are still growing and he or she has moderate scoliosis, your doctor may recommend a brace. Wearing a brace won't cure scoliosis or reverse the curve, but usually prevents the curve from getting worse. The most common type of brace is made of plastic and is contoured to conform to the body. The brace is almost invisible under the clothes as it fits under the arms and around the rib cage, lower back and hips. Most braces are worn between 13 and 16 hours a day. A brace's effectiveness increases with the number of hours or day it's worn. Children who wear braces can usually participate in most activities and have few restrictions. If necessary, kids can take off the brace to participate in sports or other physical activities. Braces are discontinued when there are no further change in height. On average, girls complete their growth at age of 14 and boys at age 16, but this varies greatly by individuals. Surgery. Severe scoliosis typically progresses with time, so your doctor might suggest scoliosis surgery to help straighten the curve and prevent it from getting worse. Surgery option includes spinal fusion. In this procedure, surgeons connect two or more of the bones in the spine, that is the vertebrae, together so that they can't move independently. Pieces of bone or bone-like materials are placed between the vertebrae like metal rods, hook, screws or wires, typically hold that part of the spine straight and still while the old and new bone material fuses together. Expanding rod. If the scoliosis is progressing rapidly at a young age, surgeons can attach one or two expandable rods along the spine that can adjust the length as the child grows. Vertebral body tethering. This procedure can be performed through small incisions. Screws are placed along the outside of the abdominal spinal curve, and a strong flexible cord is threaded through the screws when the cord is tightened. The spine straightens. As the child grows, the spine may straighten even more. And the last but not the least, apart from all the other thing, is physiotherapy and yoga. Now, when looking for ways to manage scoliosis, many people turn to physical activity. One form of movement that has gained a lot of followers in the scoliosis community is yoga. Physical activity such as a regular yoga practice is one form of treatment your doctor may recommend to help you deal with the challenges and pain that accompany scoliosis. That said, there are some things to consider before you flow into a yoga sequence. What are the yoga do's and don'ts for scoliosis? That we will cover in the next part 2 of scoliosis. Take care, keep smiling. Namaste.